This ointment is used to treat diaper rash with a yeast infection in children. It should be used along with proper cleaning of the diaper area and frequent diaper changes. Miconazole is an antifungal that works by preventing the growth of fungus. Zinc oxide and petrolatum work by forming a barrier on the skin to protect it from moisture and irritation. It is important not to use this product long-term or to prevent diaper rash, as unnecessary use or misuse can lead to decreased effectiveness. When using this product, make sure to only apply it on the skin. Before and after applying, remember to wash your hands. Clean the diaper area gently with warm water and pat dry. Apply a thin layer of this medication to the affected area as directed by your doctor, usually during each diaper change. Avoid rubbing the medication into the skin to prevent irritation. This medication is typically used for 7 days. Do not put the medication in the eyes, nose, mouth, or inside the vagina. If the medication does get into these areas, flush with plenty of water. Use this medication regularly for the best results, remembering to use it with every diaper change. Continue to use this product for the full length of treatment, even if symptoms improve after a few days. Stopping the medication too early may cause the infection to come back. Do not use this product for longer than prescribed. If your child's condition persists after 7 days of treatment or if it gets worse, be sure to inform the doctor. This medication has been prescribed by your doctor because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to tell your doctor if you notice increased irritation at the application site. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist for advice. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using this product, it's important to let the doctor or pharmacist know if your child is allergic to miconazole, zinc oxide, or petrolatum, or to other azole antifungals. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. Before using this medication, make sure to inform the doctor or pharmacist about your child's medical history. If you're pregnant, this medication should only be used when clearly needed. It's important to use caution when applying this medication on your children and discuss the risks and benefits with your doctor. It's not known if this drug passes into breast milk, so if you're breastfeeding, it's important to use caution when applying this medication on your children. It's best to consult your doctor before breastfeeding. It is important to be aware of potential drug interactions that may affect how your medications work or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products your child uses and share it with their doctor and pharmacist. It's important not to start, stop, or change the dosage of any medication without the doctor's approval. If this ointment is swallowed, it can be harmful. If someone takes too much and has severe symptoms like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. This medication is for your baby's use only and should not be shared with others. It should only be used for your baby's current condition and not for any other condition unless directed by the doctor. It's important to continue with regular diaper changes to help the diaper rash heal and prevent future rashes. If you forget to use the ointment, use it when you remember. But if it's almost time for the next diaper change, then don't use the missed dose. Just use the ointment at the regular time, and don't use extra to make up for the missed dose. Keep this ointment at room temperature, and make sure to store it in a place that's out of reach of children and pets. When you need to get rid of it, don't flush it down the toilet or pour it down the drain. Instead, ask your pharmacist or local waste disposal company for the right way to throw it away when it's expired or you no longer need it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.